Welcome back to Sunrise Daily. We've got Dr. Nubwa Medugu, who is a clinical microbiologist at the National Hospital, Abuja. She joins us this morning to continue in our quest to raise more awareness and recommend or come up with preventive measures for the meningitis going on in some states at the moment. Thank you for coming on this morning.
Thank you.
Well, at the moment, do we have any fresh case now at the National Hospital?
Oh, no. There's no case at the National Hospital currently, to the best of my knowledge, at least not for Neisseria meningitidis. Although routinely we have other cases of meningitis that we see, but for Neisseria meningitidis, there's no case as of now.
So we understand that you, time and again, you get to the field to see what's happening. Are there any improvements or from what you've seen?
Well, the level of preparedness this year seems a bit higher than it was last year. So I'm a bit surprised that the extent of the spread of the outbreak has been this much, actually, because in 2013, 2014 and 2015, we had outbreaks of meningitis in those same areas. As the one in 2015, the same serotype C, actually, so I'm a bit surprised why it's, everyone is calling it a new strain. It has caused the last 3 outbreaks in Nigeria, actually, so it's not very new.
The C strain is not new to us?
No, it caused the outbreak in 2013 and 2014, and then the one in 2015 also. The one in 2015 claimed 3,000 to 6,000 lives, depending on whose statistics you are looking at.
In Nigeria alone?
Yes, in Nigeria alone, yeah.
In 2015, did you say?
Yes, in 2015. There were, yes, 3,000 to 6,000 cases and over 300 deaths, which is what we are at currently with this current one. I think what happened then is, because we're limited to Sokoto, Kebbi, and Zamfara, there was not a lot of outcry over it. But yeah, it did cause a lot of morbidity and mortality.
I'm sorry, I was not clear with the figures. Did you say 3,000 deaths or 300?
Okay, 3,000 to 6,000 cases. And over 300 died.
Okay.
Yes.
Now that the rains have come, in Abuja, for instance, we've recorded about 6 deaths from the expert who spoke to us yesterday. Yeah. The rains have come. Does that create any relief?
Oh, yes, it does create a lot of relief for various reasons. One, the humidity increases, so the likelihood of bacteria spreading through coughing and sneezing goes down because the humidity tends to bring the bacteria down. Also, your immune response is a bit better because your mucous membranes are well lubricated. So hopefully we should see a decrease in the number of cases. Although I haven't seen any confirmed case in Abuja, actually. It's just been suspected cases. Hopefully the rains should come in Kebbi, Zamfara, Sokoto, the states most affected, and that will help. We're in week 12 of the year, so usually the rains come about week 14, 15, and if they come about then, we should be fine. The rains in 2015 came in week 17, which was why the outbreak was a bit extensive.
So knowing that, we will most likely will be prone to this. First of all, we're on the epidemic belt, we have been told, and we're prone to this, especially in the peak of the dry season. What do you think that people can do to ensure that they prevent this disease?
Okay. Well, it's basically a disease of poverty and malnutrition. So aside from the people, I think the government has a huge role to play. It doesn't really affect people in cities, people that are rich. So I think empowering the people, getting them out of poverty is key. Also, for those that it can reach, hygiene is important. So when you're coughing, I see a lot of people coughing and just doing this. What happens is the next hand you shake or the next door you touch, you spread the germ. So the best way is to do it into your elbow. That way you don't spread it. Also, try not to live in overcrowded conditions. What happens in the Northwest is they have these small rooms with tiny windows, and then the whole family, up to 7 people, can crowd in one place and sleep. So of course that predisposes to infections. My hope is that it doesn't spread to the northeast, because there are a lot of IDP camps, and what happens is you have a lot of people meeting together for the first time. So if they are carrying the serotype C strain, then the serotype C strain can easily spread because of the weather and cause an outbreak in those camps. So I hope the vaccine gets to the northeast before this happens.
Well, we understand that there was, I think, a suspected case yesterday found in Borno State. I think it's been isolated already.
Okay.
But yes, our hope is just as big as yours that the vaccine will get there before there's any more cases reported. But you say that government has a big role. Government should tell you that lifting people out of poverty is an ongoing, situation. It's an ongoing project or program. Do you think that we should be changing how it is that, we educate the people? Would you say that we've done well in terms of campaigns?
No, basically because we have weak educational systems at the primary level, and also because we have, I think, the national primary health system or the primary health care is supposed to be like the cornerstone for the education and management of meningitis outbreaks, but unfortunately it hasn't been very strong, and without that you can't get anywhere. And also important is once you get a case, you give chemoprophylaxis, which is to give antibiotics to very close contacts of those person, of the particular individual. I'm not sure that is going on right now, although it really helps.
So what's the current situation with vaccination at the moment?
From the last I heard, we're expecting at least 2.8 million doses. 3,000 doses have reached Zamfara. Of the 5,000 that we have on ground, about 800,000 more are coming, but it's for the AC. Now, key is that we've had an outbreak of W135 in this country before. So what will happen is this serotype C, I think almost everybody in the health sector knew it was going to cause the next outbreak. There have been papers saying it is going to cause the next outbreak. I don't think we're just proactive enough to get the vaccines on standby. So we've had W135 in 2010 before. So as soon as we get the C down, W135 could be something that will cause a problem. Okay. So I think the best way for vaccination would be to go with the quadrivalent vaccine, which also covers for that one.
All right, well, we'll talk about that a lot more when we return. Don't go away.